My name is Robyn Gonzales, and I'm a Vice President for Community Medical Centers, and I'm here to give you an update on the state of the COVID crisis. In the middle of a crisis, it's important to take a moment and reflect on all that you and your team members have accomplished. This pandemic has forced us to operate in new ways, to tackle new roles, and to change policies. And while COVID has been at the forefront of our work, we have continued our commitment to provide high-quality care for all of those in need of our healthcare services. You've likely heard the word surge often, but we want to share a little more with you about what exactly that means for our organization and how that affects you. As local COVID-19 cases climb, so do hospitalizations. On average, 10% of people who have COVID-19 are hospitalized, and unfortunately, those that are hospitalized, they're often here for a few weeks. Before COVID-19, our hospitals were busy and typically operated at around 90% capacity, but in the last few weeks, our census has reached historic levels. Fortunately, the work that was done in the early months of the pandemic prepared us for the significant increase in patients that we've seen in the past several weeks. Our initial work included identification of multiple areas that we felt could be expanded or repurposed in the event that we had a surge of patients. We refer to these as surge areas. Some of our surge areas are traditional clinical areas that have been repurposed, and others, such as the sequoia rooms at CRMC, are not typically used as clinical space. Preparing a surge space goes far beyond just putting a bed and some equipment in a room. Once those areas were identified, we had to determine what was the most appropriate and safe level of care to provide there, to add infrastructure and equipment, and eventually to develop and implement a staffing plan. This effort has required a great deal of creativity and flexibility on the part of our staff. Some of our examples of surge space: at Community Regional a few weeks ago, we converted the 2 central recovery room into a 10-bed ICU. And just today, we added 12 more ICU beds in the pre-op area of the endoscopy suite. And as a side note, we filled those beds already. In the midst of the pandemic, we repurposed the outpatient surgical center at Clovis Community to become an ICU unit for COVID-positive patients. One of our most creative endeavors was to build out a 50-bed medical surgical unit in a shelled-out space in our North Medical Plaza office building. We are routinely able to staff 20 of those 50 beds and continue to bring on additional staff to enable us to fill the remaining beds. But as I said earlier, to us, a bed is much more than a piece of equipment in a room. It's our highly trained staff and physicians who bring that bed to life to care for our patients. In the end, it's always about the people. I just want to say thank you on behalf of the Command Center for all of the work that you do every day. We know that it's stressful. We know that some days it feels like you just can't go on, but you do keep going on. And I appreciate that so very much. Thank you. For more information about the coronavirus pandemic and its effects on our hospital system, visit communitymedical.org/coronavirus.